welcome to the October 2nd edition of the Poultry Keepers Live.
Why is it second edition? Oh, October 2nd.
October 2nd.
Not second edition. Okay.
Yeah, like we didn't do a first edition earlier today.
Yeah,
That would have been fun. Probably more fun than sitting in traffic, but you know, that's how it goes, right?
Yeah. I got to learn how to understand and speak and understand Alabama.
Well, I gotta brush up on my Spanish because I was getting messages from a guy earlier, and you know, it's pretty sad when somebody, obviously not from a Hispanic speaking country, picks up that your translating app sucks. It must really suck.
You were trying to translate?
Well, I was trying to use the Google Translate to see if I thought he was saying what he was saying.
Yeah.
And it didn't look, I thought I was right and I thought it was wrong. So, of course, I sent it to one of my daughters and I was like, hey, I think this guy's saying this. Google Translate is saying this. And she laughed and she said, Papa, you know, Google Translate's usually wrong. I was like, okay, I just wanted to make sure. So, yeah.
Yeah.
Tonight, I know we only got 60 minutes. And
here we go.
This may go into two shows. I don't know. But it's that time of year where stuff is starting to show up. Birds are starting to get issues. And, you know, people are wondering what it is. So I figured, hey, to help these people, let's do a show. So
let's put it on paper, right? Let's do it. All right.
So to speak. You know, we're going to talk about Fowl Pox, Marek's, other parasites. And, you know, you get me and Jeff together, we're going to talk about natural remedies. And, you know, because, I mean, we don't even take antibiotics ourselves unless we're about to die.
Yeah.
And then it could be debatable. So, you know, like Rip says, you are what you eats. And
yeah,
if you eat your eggs or your chickens, you don't want to put in there. So, yeah.
Well, let's get to it.
And even she agrees.
Mm-hmm.
It is as good as ChatGPT, especially when you ask ChatGPT chicken questions, because whether or not it's correct is debatable. All right, Jeff.
Yes,
everybody knows what dry fowl pox is. Here recently, we started seeing a bunch of stuff online, of course, about wet. So can you tell us the difference between wet fowl pox and dry fowl pox?
I mean, dry fowl pox looks like a black freckle or a black dot on a comb or a wattle or a skin area where a mosquito has, you know, drawn blood, you know, bitten, drawn blood from your bird and, you know, is spreading that virus. It's spread the same way as wet pox is spread the same way. However, it's a more virulent is a word I shouldn't use. It's not made for me, but anyway, it's a more difficult version of fowl pox where you will see discharge out of the eye, discharge out of the nasal. You'll hear respiratory, you know, respiratory sounds that you shouldn't be hearing. To me, wet fowl pox is much harder to manage because of all the discharge. Okay.
Yeah.
Dry pox, you know, the bird will act a little lethargic. It'll act ill a little bit. Generally, don't kill birds with dry pox, with the dry version of the fowl pox, but
Right.
it doesn't look good, especially if you're going to show.
Yeah.
But wet pox is really messy, right? So
One of the things that I saw that described wet pox, like, made it sound and almost look like the bird had lesions around its mouth because of the
mucus,
and stuff coming out of its like eyes and ears.
Really severe cases. I've only seen a handful of those over the years. Usually it's just eye discharge, nasal discharge. You can get some out of the beak, oral discharge, depending on how far it goes. When you get to the oral discharge coming out of the beak, that's when, I'll see like those lesions / scarring. But a bird with a strong immune system, it usually doesn't get to that point, but it can. And I see a higher mortality with the wet pox.
I was going to say the wet fowl pox, a lot of the stuff that I saw also referenced the higher mortality because, I mean, to me, the easiest way to explain the dry is it's like a very light case of a kid getting chicken pox, which I don't know which one gets its name from the other.
I don't know.
Dang mosquitoes, which I came up with a really good natural remedy that so far, knock on woods, none of my birds have been affected by this year, even though I'm in like an area where mosquitoes are the size of houseflies. My natural remedy is bats.
Oh, you got the bat house up.
So several months ago, we talked about it, and I don't know if you and Rip thought I was joking or not, but I actually bought a 16-foot post, and it was a 6x6, which is an overkill for 2 bat houses. But you can't get a 4x4 anywhere locally that tall. And I used my new handy dandy weed eater powered auger and buried that thing in the ground as far as I could. Stuck the post in there, which pretty heavy by my add. If you get the corner in and hook the top to your truck, you can make it work. But once I got it in there, I got on a step ladder and was able to screw those in. And there's some kind of pheromone spray or something I sprayed on them. And I didn't think nothing about it. I got it sitting over out of the way because they don't like to be near lights and all that kind of stuff. So put it down in the wood line. Everything just went. Till one night I was out there tucking my birds in, and some other birds made me say some 4-letter words flying through the air. And then I realized that I invited them. And we don't have a lot of mosquitoes anymore. That I don't know if they really can eat like 20,000 of them a night, but I can say my population around my house of mosquitoes has greatly disappeared. So, is there anything else that you can do for fowl pox?
You just keep the immune system as high as you can.
Would you, like, if your birds got it, I mean, essentially the only thing you can do is feed them really good, maybe give them some garlic tincture in their water and treat the symptoms while they're,
believe it or not, the garlic,
getting over it.
Yeah, the garlic tincture or the CEG work really, really well for it. Right. So just depends on how far you let it get before you started treating it.
Yeah.
It will spread in shared water bowls, watering devices, things like that. So
Mhm.
you can spread it, orally or, from the mucus. So you should isolate those birds. Like I said, dry fowl pox really is not, I don't see a lot of birds dying from it. They
Yeah.
just act really sick for about 3 days and then they seem to come out of it. But those black dots on their combs and wattles
Mhm.
don't always go away, right? So you can almost tell if a bird's had fowl pox in the past. Now,
Because they'll have like on their comb, especially if they've got the specks like in the comb on the sides or whatever, that means that they've either been fighting or it could be a scar from fowl pox. Is that what you're saying?
yeah.
Or a good chance of it?
Well, that little black spot where the mosquito bit them
Mm-hmm.
can be there for years, right? There's some flocks that I get the opportunity to visit, on a semi-regular basis,
Right.
and you can see that black dot from the fowl pox. It's still there from previous years, right? So it's very, very slow, and I don't know if those skin cells on the comb and wattle regenerate slower than others do, and maybe that's why.
Yeah.
Or does that discoloration, that black dot from the mosquito bite, does it go deeper into the tissue and take that much longer to grow out, so to speak?
Well, I know there's been some mosquitoes get pretty deep in my tissue, especially on my arms and my legs. I had one right here on my eyebrow one time, and that was painful. Laura said that the CEG for a couple of friends' flocks that had respiratory issues, it worked really well.
Yeah, it does.
Yeah.
It
The
really does. I mean, it's not cheap, but it's worth keeping on hand, because by the time you have an illness, you order it from a Dr. Paul's lab,
place.
place, and you get it shipped in, you're talking a week, right? And you don't
Mm-hmm.
have a week to wait. If you're treating an infection or an illness or something like that, then you just don't, if you let it go for a week before you treat it, that's not good.
Yeah. People ask about yeah, you see all the time, what do you have in your chicken medicine cabinet? Well, I got some garlic tincture. I got some stuff that I made with oregano, and I got a hatchet. Um,
See,
so
I'll give okay, for something like fowl pox,
yeah,
I don't know how much of a natural immunity a flock is going to build up to that, right? Because you could go 10 years and never have fowl pox, and then you get a warm summer breeze blowing in from the south off the swamp, and all of a sudden you got it, right? So it's
see, I
not
never had it till 2 years ago,
okay.
and two
Perfect
years ago
example.
the mosquitoes were the worst because we had a really mild winter. So usually
Oh,
if it's below freezing for a week at least in a row, we have a lot less population of them. But that
you,
didn't really happen that time. So
yeah, you should be okay. So we're coming into migratory season. We've already started migratory season of the waterfowl.
mhm,
So for the most part, the waterfowl or migratory birds are carriers and they have immunity to it, you know,
mhm.
because they've had repeated exposure. Well, the mosquito, bites a duck, you know, injects a duck or draws blood from a duck. Next thing you know, it, blows in and injects your chicken, and well, there you go, right? That's how it moves around. It's
Yeah,
not like not every mosquito is a carrier of fowl pox. So it's not,
you should
but
be good. Ted says, what is CEG? CEG is a product made by Dr. Paul's lab. It's a cayenne, echinacea, and garlic tincture together.
Yeah, they're all tinctured together. I don't know the formula, so I don't know the ratio of the garlic to cayenne to echinacea. But yeah,
Well, I know the taste
it's not good, but
because I will say this stuff works good for people too.
works really good.
I was having a respiratory issue, and I took a spoon of it straight out of the jar. A lot more than what I expected. I didn't realize I had a respiratory system for a few hours. So it's definitely really hard on the cayenne. But the next day when I woke up, hey, I had no issues. It was well worth it. So that's what it is. It's a great product. It's not cheap.
It's
no
not,
matter where you look for it.
but it's got an insanely long life, shelf life on it, right? Because it's in the grain alcohol,
Right.
And so as long as you store it half decently, it's going to be. Sue says she made it.
Yeah, you can make it. I have some in my closet, and I would recommend you make it in an area that does not have a lot of airflow while you're doing it, which is one of the reasons why I actually have a respirator. But you can. The echinacea is not cheap, but a little
Good
bit long
echinacea is
way.
not cheap. You can find cheap echinacea.
You can find cheap everything,
right? But it's not. You take your chances on whether it was harvested correctly, and at the right stage of growth for potency. Once it goes past bloom, it's not. Echinacea is not. It's not as powerful.
So I had a good friend of mine who's actually watching put me on a distributor that sold good echinacea by the pound, and it was not quite as steep as the taste of it, but they're proud of it. But again,
About $12 a pound.
Oh, that would be nice. It was double that if I remember.
Okay. All right.
So, what is infectious bursal disease? IBD.
Infectious bursal disease.
Yeah.
I have not delved into this one a whole lot.
Now, one person said it's also called gumboro.
Gumboro. So
yeah,
so like in the Philippines or over in Asia, on that side of the world, or even down in the Caribbean islands, they've nicknamed it gumboro.
Okay.
I've only ran into it 2 or 3 times in my lifetime, so I haven't cut any open. I can't really tell you what it looks like.
Right.
It will take a lot of birds, and it'll take them at different ages if they don't have any immunity to it. Oftentimes, so they're posturing. So I'm a really big person as far as diagnosing based on what position a bird dies in, right? So for everybody who's listening, if you want my help, the best thing you can do is take a picture of the bird in the position that you found it dead in, right? Especially if this is happening to more than one, this starts to become a repeat thing.
And I promise you won't be the only person that does that, because I've been with Jeff, and people have sent him some random, rather awkward pictures of chickens.
Yeah.
So do it.
Well, people want to move them so the picture looks better, don't do that, right? You move to get the picture right. Don't move. Never move the dead bird to send me the picture. But like everything's different, right? So if they're, but the infectious bursal disease, I always find them straight out, right? Legs straight back, face down, right? Head stretched out, but it's not the only disease I find a bird in that position. But that's one of the clues, right? So the position a bird dies in is a big clue as to what might be the illness. So take the picture before you move it, okay? And you're never going to describe it to me well enough. Just take the picture, right? In this day and
Picture's
age,
worth 1,000 yards,
right,
1,000 words.
This day and age, almost everybody has a smartphone. Zoom in on it, take a really good picture, take a couple, send them, right?
I mean,
take pictures. Take pictures of the sick bird before it dies, right, and send that. So for whatever reason, they posture differently based on what part of their body is being affected. Okay, so, but I have not, because of how, because of how kind of strong or scary infectious bursal is, I have not actually opened any up, in the field. So,
well, I mean, you could run the risk of spreading it.
Right. Yeah. And that one's pretty harsh.
I've heard of bursal in cattle. Is it by any chance the same?
I don't know.
Or maybe a different strain?
You got me.
Well, I know what I'm doing tomorrow. I'm finding out. What kind of management practices could you do to prevent CRD, or commonly called mycoplasma, or pretty much any other respiratory disease? What is it? What is something you could do as a management practice to prevent that?
I mean, most of the time your CRD is going to come in either with rodents or with wild birds, right? I mean, you can track it in on your boots and shoes depending on where you were at. I mean, hopefully everyone, this show's been going on long enough, and that the majority of the people who come and listen and watch, you have a set of boots that only goes to your chicken houses and never leaves the farm. Okay. Like, you got chore boots, and your chore boots should never go to somebody else's farm to do chores, right? It really should not leave your acreage. Okay. It should, so that's, people don't actually realize how many things they track on their own. They walk it in, right? So the shoes and the boots that you wear off your farm or off your place, you park those at one door, and you put on your other boots for taking care of your animals. Smartest thing you're ever going to do. You probably should have a different set of clothes, cheap pair of coveralls, something like that, stays, it's what you do your chores in. You need to be really careful with visitors. Everybody loves to show off their chickens, right? Or their animals. I get it.
That's what pictures are for.
But you just have to have some protocols. It's not that big a deal to get, a little flat tray, pour a little bit of bleach in it or something like that, somebody steps in on their way in. Okay. Just little things like that. Cheap little things like that.
Like Rob says, at the very least, he don't want his shoes with chicken poop to go anywhere with him, let alone the fear of bringing something back.
Yeah.
And I get it. Because, like, if you walk into my red barn, which is the one that's right at the end of my driveway, you'll see my boots, and there's two other pair of boots in there. It's my hands. I bought both of them a pair of boots before they started helping, and they stay in the barn. And I told them, I was like, hey, look, you're the only person that's going to wear them. Nobody else is sticking their sweaty foot in it. But this is your pair. I don't want you to come from somewhere else. I don't know if a chicken person with some kind of disease walked through Walmart, then you walk through Walmart and bring it back to the house. I don't do it. The boots, once they go in that barn, they don't leave the property.
Rob was making a comment about the powdered bleach. Rob, actually, it's just the powdered chlorine that you would get at a pool supply. You can get it in the large buckets, right? So it's you can get dried granulated bleach. You can get it at Walmart, in the little pails. It's just, powdered chlorine.
Yeah.
You should be able to get it. It just doesn't say bleach on it. It uses the term chlorine on it.
Yeah, it'll say either chlorine or sodium hypochlorite.
Yep.
Let's see.
Now you're getting technical.
Well, I make it, so
okay.
I know a thing or two about chemicals. Is it a good idea to add garlic and apple cider vinegar periodically to water or only when needed?
Here's the thing, and everybody needs to hear this, right? So while I love using oregano, thyme, basil, garlic, cayenne, all these different herbs, when we start using them every day or on a routine basis, you now take the opportunity away to ever use them as a treatment. Okay, so you need to decide, do you want to use these as that treatment when something does go wrong? Now, vinegar you can use all the time. Right? I have no issues with that. You follow your own personal beliefs and convictions on whether vinegar is good, bad, or indifferent. I always used vinegar in the chicken water, when we had our chickens here. But all of these healing herbs, you got to be careful using them all the time. Eventually, you can, the bacterias and the viruses can eventually build up a resistance to them. But I don't get the same effect out of using them as a treatment when somebody uses them as a nutritional supplement. So you really got to be careful there. You got to make up your own mind. Either you're going to feed it all the time and use it, or you're not.
Yep. What are common signs of fowl cholera, and how might you manage an outbreak?
Fowl cholera. Okay, so when you start getting into a lot of these different respiratory diseases, like a fowl cholera, CRD, etc.,
aren't a lot of them kind of the same?
Exactly. At the farm level, right? Trying to diagnose them, you can be chasing. Most of these are coming from the mycoplasma family anyway, which are really, really difficult to manage. So yeah, I mean, just you're going to see that, you're going to see those. You can see. The only one that gives you a telltale is Newcastle, because you get the wrinkled eggs, right? You start seeing wrinkled eggs. The rest of them, you just see that you hear that rattling. You're going to hear some sneezing, some snitting, but you don't know which respiratory you have. It could be coryza, could be CRD, could be fowl cholera, right? Fowl cholera has a higher mortality usually than coryza or CRD, but without getting it cultured at like a university vet lab kind of thing,
right?
It's really hard to pinpoint and know exactly what you have. And that's why, on some of the different Facebook groups that I am still on, as far as poultry goes, people trying to identify whether it's CRD, fowl cholera, even true coryza, right? And these different, at a farm level, it's almost impossible to tell exactly which one you have, right? Because the symptoms are so close together.
I was going to
Because
say, you're going to need a scalpel, a microscope, patience.
well, you really have to get it cultured, right? So you're pulling
And
blood work. You're
yeah,
doing cloaca swab. You're doing mouth swab. Mouth, tongue, throat swab. You may be doing a swab off the nostrils if there's discharge. And you're getting these to a lab for being cultured so they can pinpoint it, right?
and so with if they're all mycoplasma related, the same thing will fix it, regardless of which one it has, if it's even fixable, right?
most of those are not truly fixable, okay, because there's a limited amount of antivirals out there. I mean,
Right.
there's some, right? And some of the herbs are excellent. And this is when I'm going for that combination of oregano, tea tree, probably some cinnamon oil, and I'm using it off label a little bit higher than you should. But a couple things have to happen. One, you had to have made the observation really, really early at the onset of that virus. Okay. And you started treatment then. You've got them quarantined and separated. So when you start getting into the CRDs, anything mycoplasma family related, I honestly think it's time to get the hatchet out, right? I just, to me, it's not worth the gamble of how far that's going to spread in your flock. So you can try quarantining them and treating them, but I truly feel that they're going to live with it, right? That virus is going to be in them. It may not be active, but under severe stress,
Yeah, when they get stressed out, it'll pop out like a lot
it's
of
going to
stuff.
pop out again. Because I've seen this with Newcastle's a lot. You think you got it under control, you treat it like crazy, the flock looks healthy, everybody's cruising right along, and a rainstorm or something goes through, and you got another outbreak.
Right.
So
Rob said he thinks Denegard's still available. I've seen something that was supposed to be, I want to say like the generic version or something like that on Amazon. I don't know if they're similar or not. I just know that the name is very similar and a lot of people say it. But yeah, you could mix that in water and see what happens. But like Jeff said, it's viral. And I don't really know. If you don't get it fast, I don't know that anything will fix it. Uh, Jeff, what about botulism? How does botulism affect chickens, and what clues you think you'll see in that?
well, okay, so botulism comes from Clostridium bacteria,
Okay.
and and it's funny because a guy called me this morning, right, with the symptoms, and it's happened to me a couple times, but it's we. You ever see the old guy at the back of the old guy in church who's falling asleep when the preacher's bringing the sermon, right? So the head slowly drifts forward, and then he catches himself, and he slowly drifts forward. So some people refer to it as Limberneck. Some people, I've heard it called church neck. But any animal, when it's reached its threshold of tolerance for the Clostridium bacteria or what it ferments into, causing botulism, right? They lose control of head and neck muscles. So they're unable to lift their head to a normal height, right? And keep it there, right? And that is the 100% telltale symptom. I love it when I get the call and people are describing to me what's going on. And I say, well, you got botulism. No, I don't. I think, okay, you have the wrong person to talk to because you have botulism and you need somebody with PhD, DVM, blah, blah, blah at the end of their name to identify it for you for, $150 later. But any animal that cannot hold its head up and it slowly loses control of it, it is 100%.
Some form.
Yeah, 100% guaranteed botulism. Right now, when I visit chicken yards and I see those potholes, they dig in them, they'll scratch down in there, and they're eating at the bottom. Those you've seen it. You know what I'm talking about, right?
Yeah.
They dig, yeah.
They'll dig their own hole and get in it, especially in the summertime.
Yeah, but when they start eating, so when Clostridium ferments, it makes this almost like a sickening sweet smell.
Yeah.
And it actually attracts them to eat it, right? So they like the taste of it. And then early on, it almost feels like a euphoric type drug, right? So it kind of makes them feel good, when they eat a little bit of it. So they eat a little more, and then they keep coming back every day, and they eat more, and they eat more, and they eat more, and eventually it builds up in their system, and it will eventually kill them. And I have not found a really good treatment once it's in the bloodstream to the point there, where you're seeing, the loss of head control. It's 50-50 if you can pull that bird or that animal out of that situation. So Clostridium's 100% management. It's a 100% management issue. Whether you fed moldy feed, spilled feed on the ground, things like that. They have to ingest it, right? It's not spread from bird to bird. It's not contagious, right? It's something that they've ingested.
Got it.
Yeah.
All right, cool. Hold that thought.
We would like to take a short break to express our appreciation to the Fortrell Company for their sponsorship of the Poultry Keepers 360 Live programming. Fortrell has been a trusted name in sustainable farming and poultry nutrition for decades, and their commitment to providing high-quality, natural products align perfectly with the values we hold dear in our poultry community. Thank you, Fortrell, for partnering with us to empower poultry keepers everywhere. We're truly grateful for your dedication and support.
All right, so let's see. What is gout in poultry?
Gout is very similar to what happens in a human. Most times it's from overfeeding protein, and you'll get a uric acid buildup. We tend to see it because one of the largest, more active joints is the hock joint, where you go from feather to scale in the leg.
Right.
We'll tend to see it there. We can see the crystal formations in the foot. So, I don't know how many people realize this. Sue probably knows it, but in the human body, when a toxin or an overload of something is detected, the body tends to push it to an extremity, right? So it'll go out to fingertips, it'll go out to toes, it'll go to feet. It's going as far away from the major organs as possible to reduce the effects, right? So, and this is what happens with uric acid in humans. Same thing's happening in chickens, and it ends up building up in the hock joint or the foot joints. Okay. The bird will start walking funny, or walking, very oddly. Some people refer to it as high stepping. So when you see a chicken that takes this like over exaggerated step, like they're keeping their leg almost straight and taking a really high step, and
like they're trying to prance around or something.
Yeah. That's the easiest way to detect it or see it. It's not the only way. So in our standard fowl, here, I also worry about seeing them sitting all the way back when they go to the sitting position, to be sitting all the way back, sitting on their butt, right? Literally sitting on their butt instead of having their legs folded under them. So if they're not using or bending that hock joint, the way they should to take normal posture or position. Again, this is why pictures of posturing is really, really important for helping people diagnose what's going on. But yeah, so if they're sitting with their legs out in front of them, right, they're sitting back on their butt and they got their legs a little bit too far out in front of them, out from under the body.
You need to
can
check.
see it. Yeah, you can see it that way. You're not really going to see it in the joint. It's getting hot. It's getting sore. The bird's going to be less mobile, right? They're not going to move around. They're not going to want to move around as much as the other birds, right? So you're going to see less mobility, and they're not going to walk. They're not going to have the same walk and gait as the other chickens do. But most often, so the number one cause is the overfeeding of protein. And I've beat that to death, since we've had this show on. You don't need to overfeed protein, right? You need to get your amino acids right. Don't overfeed protein. Feeding more protein is not the answer. Okay, get the right feed, balance it out. So anyway, now in roosters or male birds that have been overfed calcium for too long a time, you can also see very similar signs of gout. It takes a lot longer. It's not as noticeable, but that you'll end up getting some calcium buildup in some of those joints, causing pain, like arthritic type pain.
Yeah.
And they won't be as functional or as mobile as you want them to be.
So again, it's kind of a management thing.
Yeah, it's a dietary. It's a dietary imbalance. It's 100% management. It's not. Gout is nothing contagious. It's not spreadable. It's not going to go bird to bird. Nothing like that. So
now, sometimes the bumblefoot could be a staph infection too, right?
You said something completely different. Gout and bumblefoot are not associated. So bumblefoot is 100% caused by an exterior puncture, like a splinter or something, right? And I find it more in wetter conditions where the bedding's been allowed to go too wet. The bird's been on it too long. The foot pad gets extremely soft and pliable, and then it allows, whether people using wood chips, large shavings, some sort of environmental thing, that there's a small puncture in the bottom of that foot pad that allows that staph bacteria in, okay, and starts to grow in that foot. It doesn't come from the inside, right? So there's a lot of people who think that, they were fed wrong or whatever, that, bumblefoot's going to start from the inside of the bird. No, it has to enter in through the skin and then load up in that point to be a true bumblefoot.
Gotcha.
Right.
What about roundworms, cecal worms, gate worms, those kind of things?
The eggs and the larvae have to be ingested, right? Again, they're not going to be spread from bird to bird through contact, through shared feeders, through shared waters, nothing like that. It's going to be a buildup of the egg and the larva in the bedding or in the ground, the soil that the birds are on, things like that. So, they can get tapeworms, they can get roundworms, they can get, there's a handful of different kind of internal parasites that birds can contract. And, this is why you and I discourage people from feeding on the ground. Okay. It's just, you just don't do that. Okay. And people say, well, my chickens eat off the ground all the time. Well, do they really? Let's pay a little bit more attention. So they're going to go scratch some dirt, or they're going to go scratch something. And what they're really looking for is they're waiting for something to move. They're looking for an insect, right?
Yep.
Or
looking for something to pop out and take off running.
Right. Yeah. That's what they're And sometimes they'll actually go down if they think they see something, and they'll use their beak to like
Peck
stir
through the
that
dirt.
spot. Right.
Yeah.
Right. But they're not. So people think that they're eating something. Right. And they just don't spend enough time with their birds to know what the bird's actually doing. You know, they're just.
I had one person to me say, well, birds at free range, they eat off the dirt. I'm like, yeah, kind of. Probably more accurately, they eat off the grass. But
I mean, they're eating.
they're also not, they don't poop where they're free ranging, except for behind them. You know, when you have them in a pen and they poop all over the place, you're throwing it in their poop.
Right. You know, so the bird's instinct is to go out, scratch, you know, kick around some dirt, take a step back and look for
They're
something.
scavengers.
Right. That's what they're doing.
Yeah.
So when you see them, you know, again, even a free ranging bird, the majority of the time they're eating like a full seed, right? That just fell off of something. Rarely are they eating a seed. They're really looking for the insects. Okay. They're looking for the ant. They're looking for the spider. They're looking for the small lizard, you know, salamander, whatever. That's what they're after, right? And they, believe it or not, they find a lot. There's a huge amount of insects per square foot of good range area that you can get a lot of really good protein from free ranging, if that's, you know, if you can do that, right? So
I was gonna say there's a lot less of a population in my backyard than what there used to be, because since I enclosed the whole thing and built some rather large grow out pens, I throw chickens. You know, I put some pullets in one of them and with some turkeys, and you know they're just like ooh, and they just started going to town. They hunting and pecking all across it, finding stuff. You know, you have chickens in your yard, and you won't have ticks, crickets, frogs, none of that stuff.
yeah, I mean, I told this story on here once before, but we had a snapping turtle that would come across the road from the pond, layer eggs, and once, you know, when they hatched one early summer, then or midsummer, we actually had 2 or 3 of our chickens running around with baby snapping turtles they're holding on to, running around like they found the best thing ever, right? You know, these little, you know, inch and a half long baby snapping turtles were headed back to the pond, right? And
I mean, was their shell hard at that point?
No, it's not, right? So
I'm gonna say it's like chicken pecking on some wood or something.
my wife was freaking out. What am I supposed to do? I'm like, do nothing. They're doing what they're supposed to do. Leave them alone, right? And
chickens are chickening, and if they got caught, the turtles ain't turtling.
You know, the 2.5 years that I had guineas here on the property, we picked 0 ticks off of any of the pets or family. They are the best tick eaters. But my neighbors were not
also
very
the most annoying.
noisy. Yeah, my neighbors weren't real happy about me having guineas, right? So
I can see that.
But they're hilarious. They're just hilarious. Right? So.
What is coccidiosis?
Coccidiosis is like a really small parasite down at the protozoa level. You know, and the bird again has to ingest it out of the ground or somebody else's poop, right? They're picking up the oocyst, and it builds an infection along the intestinal wall, you know, where it starts burrowing in and colonizing. But you don't treat it with a parasite. You don't treat it with like a wormer. It doesn't respond to that just because of how it lives and thrives, and the size and shape of the body is extremely small. I mean, you're not going to see them with the naked eye. Whereas all other internal parasites, you can pretty much see when they're mature. You can see them with the naked eye without a microscope. But you're not going to do that with a coccidiosis. But you know what? Coccidiosis is everywhere in our environment. It's been a long time since I looked up the stat, but they know that a coccidiosis oocyst in some soil types, as long as there's moisture, it's not bone dry, right, are viable for up to 10 years without a host. Okay, just laying there in the ground waiting for their turn.
So
but the bird,
if you
but
got
the bird has to eat it, right? And again,
if you
it's
got
not
it in your
contagious.
dirt, is there a way to get rid of it?
It's in all dirt. I mean,
Well,
unless
okay, so let me rephrase it. If you have toxic levels in your dirt, is there anything you can do?
well, remember I said if it has enough moisture. So every time you disturb that soil, dry it out. This is where, when I was encouraging people to use something, like a lime on their soil on a regular basis, right? Lime is a desiccant. It's going to suck moisture. And also those oocysts are not going to be happy if the pH changes really quickly, right? So if your soil after your chickens is, 6, somewhere around 6 pH more than likely, right? And then all of a sudden you change it to an 8 or a 9, with a dose of lime, even for that 7-day period after you treated it, that's enough to just totally rock that oocyst world, right? So, and steal moisture from it. So while lime is not considered a sanitizer, it has some excellent sanitation qualities to it, right? But other than that, you're not going to get rid of coccidiosis oocyst, right? They're there. They're going to be there. You can do whatever you want. I mean, you can scrape off the top 3 inches of your soil on your property, give it to somebody else, bring in brand new, and it's already there. Okay, that's what I'm saying is if it's not there, it's going to be there in really short order. It's part of that soil ecosystem. It's supposed to be there. Okay, it's just part of the balance. And truthfully, this don't get scared, don't fall off. But if you actually did a stool sample, sent it off, you would probably find some oocyst or coccidia in your stool
some
sample.
levels.
Right. It's
Of a
part
perfectly healthy bird.
Exactly. It is part of the biome. So 0 coccidia or oocyst is not good, right? But then too many is not good. So it's just keeping everything where it's supposed to be, right? You keep the community harmonized, okay, and everybody works together.
I mean, that's kind of the benefit to using all that stuff together. And again, we keep harping on the management side of it, but that's part of that management is keeping all the stuff, the nutrition, the health, the soil, the water quality, keeping all of that in check. So it does all balance. And if it's all balanced, then great. But if you, like he was talking about earlier, if you send a stool sample off and it has 0 levels, okay, you probably gave that bird some kind of something recently. And if it has nothing, it also has no immunity. So I would think that if its level was right at 0 or 0, if you had an outbreak, that would probably be the bird that died.
Right. But see, when you take out all the coccidiosis, I am convinced that there's a large percentage of poultry keepers, like after seeing backyard chickens in different groups that I was on only for less than a week because I couldn't take it. Right. I'm convinced that Corid is part of their liquor cabinet, right? They've got it right there beside their vodka and everything else, right?
Yeah.
They never run out. They've always got a bottle, right? They always have a bottle, right? So So, when you go to zero on something like that, you're opening up space in that digestive tract
for something else.
for something else, like the larger parasites or, a Clostridium bacteria or a Salmonella bacteria or, whatever, right? They all have to be in there at the right levels and they keep each other in checks and balances, right? So it's just part of the natural ecology of a
It's like
digestive tract.
the pecking order of the gut.
Mm-hmm.
Well, Rob said that he's had people say that they had a vet do a float test and there was 0 coccidia parasites, and he tells them they had a bad test. Which
Yeah.
I mean, either somebody's lying, the test was bad, or they just gave the bird a bunch of antibiotics before it went.
Yeah, I mean, on a float test, I'm hoping. So you're actually looking for the oocyst, which is the egg, right? Not the coccidia, but I'm hoping between 30 and 40 oocysts per gram, right? So it's always done on a per gram basis, right? They take 1 gram of manure or poultry poop, and that's what they float out in the saline solution, right? And they do that, and then they pull their sample off the top with a little eyedropper type, sample thing and put it on a slide.
Mm-hmm.
And then they do the math. So it's, like 30 to 40 is fine. 50, I'm not scared yet. We make a couple of minor adjustments. 60, we can still make some minor adjustments, get things back in shape. Once you start getting up, 80 to 100, then I think we have to do something a little bit more managerially harsh, but still don't really need to use Corid or Amprolium. But anyway, that's just my 2 cents worth. Give him some milk. Give him some milk.
I was going to say milk or yogurt. The Amprolium basically blocks the thiamine, and that's a B vitamin that helps with a whole lot of other stuff. So if it's used incorrectly, it'll do more harm than good.
It blows my mind how many people talk about wryneck in mature birds. I only see wryneck in the first 3 weeks of life in most poultry farms, right? In most poultry strains, breeds, families, whatever.
Yeah.
When people start talking about wryneck in year-old or year-and-a-half-old, or even anything really over 8 months old, I'm thinking, man, what did you do to screw this bird up? I mean, did you feed medicated feed for the first year of life? And wryneck is caused, so that the appearance of wryneck is either a thiamine deficiency or there's another offshoot called anyway, but it's where a vertebrae doesn't develop right. So it can be a genetic thing that will show up later in life, but it's a really, really, really low percentage possibility. But, people just jump to conclusions that it's automatically wryneck. And I'm not saying that it's not, depending on what that bird was fed and how it was raised. But man, I really hope not.
I had a person send me a picture of a bird that, appeared to be full grown, and he said, "Is this wryneck?" And I'm sitting there, I'm like, I want to say yes, because that's what it looks like, but that bird's big. And I just messaged the person back, said, "Do you regularly put cord in your water?" "Oh yeah, I treat for coccidiosis every month."
Anyway,
I said, "Roll Tide." That is about half of what I had on here to cover. So,
oh, man, we didn't get to the big ones like Marek's, and that's all right. It's all right.
I knew some of these may take longer than others because of the topics and the controversies, and I didn't know what rabbit holes we would find and all that good stuff. So I kind of planned them in an order for a reason.
Okay.
So we'll pick this up in 2 weeks, and that we'll talk about Marek's, rickets, egg drop syndrome, and the supportive care and what should be in a chicken medicine cabinet.
Sounds good to me.
All right. Till then, we will see y'all in the comments.